Hi all, welcome back to Nursing Guru for another live sessions which is related to the applied sociology who all are studying for B.S.c second year, not first year. Okay, sorry, I forgot this first year, first sem. Okay, so sorry. So that no. So, who are studying for applied sociology for tomorrow examination, for them this class is very useful for you to get the important questions in this particular class, and as well as we are going to provide you how to write the sociology examination. So, examination tips will be available here. So, watch this complete video. So, yeah. So, the next live is that sociology. Sociology. Sorry. Yeah, sociology. In that particular live, I'm taking my phone to answer you if you have any questions or doubts which may I can able to answer. No, so for that reason, sorry for the inconvenience. Okay, so let me start the class. Okay, so we have the two class, which is that one already we have finished. Now we are going to discuss about the applied sociology. So applied sociology. Okay, so I will not going to drag my classes, so I will finish it off within very few hour. Okay, 1 hour I will take the class anyhow. So you listen that the sociology, which is that we have around 7 units in this particular unit. Okay, so we are going to write in the section A. Section A, section B. Okay, section A, section B will be there. The question paper pattern we can see the long essay form of question, and we have the short essay form of question, short answer, and MCQs. Okay, so hope you all understood. Okay, even I'm writing in the short form, you can able to understand, my dear students, that I know. Okay, so now you can see that the long essay form of question, 10 marks questions, far more sure we will get in this particular subject. Okay, so 5 marks questions will be there. Okay, so the next one is that we have the 2 marks questions and the 1 mark questions, 6 or 7 multiple choice questions will be. That's how you have to answer for. You have to choose the correct answer in the particular option. Okay, so this is the question paper criteria. Okay, so now you think. So who are first time writing or who are failed 1 or 2 times, multiple times, you're not getting pass, means use these tricks to write the examination. Okay, so the complete class you have to watch it off. Okay, now I will tell you about the 7 units. Okay, first I will do the syllabus revision, and as well as along with particular one unit I will supposed to give you the important questions too. Okay, so if you can't able to hear my voice and all, you can please chat in the chat box. Okay, let me, am I audible, right? Say yes or no who are watching. I will be wait for 1 minute. So if you are audible, say yes or no. Yeah. Okay. I will wish that you are hearing my voice. Okay. So if you have any doubt, you kindly contact the, no issues in that. I will clarify the doubts. Okay. So I told you 7 units we are having in the sociology. First unit we can take a class. Okay, so that is what introduction. Who are attending our exam preparation classes, no, I have taken the entire sociology, the 7 units I have explained you, and with the important questions and how to write the answer, each and everything I have explained in that. Okay, so let me speak about this particular unit. The introduction itself, we are going to study about the things which is like definition. Sociology, socio means society, logy means study, the study of society we will call it as the sociology. That is very easy definition which we can able to learn. Okay, so that is okay, no issues, but you have to write it down the 2 3 definitions, so that you have to study from your textbooks. Okay, so don't use multiple textbooks, use one textbook. So here I'm using this Professor Dr. P Ganesh. Okay, so this textbook I'm using, you can see it over here, that this textbook is quite okay, not quite okay, so really it is okay. So everything which we can able to get it off by this point wise. Okay, so this textbook I'm using, if you have, means you could have also chance to use this and you will get the good marks. Okay, so okay, so the definition we have, the nature, scope of sociology, significance of the sociology in nursing. Okay, so only three will be their definitions: scope, nature. Next one is that we have the one more thing, what is that now, we have significance. Okay, significance or the significance we have. So these three are significance in nursing. Okay, so what is the importance in nursing, that is which we have in the first unit. Okay, let me speak about this important questions. Why? Because you are waiting for the important questions only, right? So I will not going to drag you. Okay, first question which we can able to expect from this unit is that the significance of sociology in nursing profession. Okay, so that you're the one of the very important things which you have to study. Okay, so the next one is that short notes. In the short notes or the shortest type of question, we can get the questions like write about the nature of sociology, scope of sociology, characteristics of sociology, and functions of the sociology. Okay, so these many questions which we can expect. Next one, theoretical sociology and practical sociology, applied sociology, the explain definition we can expect. Okay, these three types of sociology. So that is what regarding. Okay, so regarding this particular unit. Okay, so most of the things I have covered. Okay, most that only important in this particular unit. Okay, then the questions like list out the branches of sociology, methods of sociology, also there is a possible. Okay, so the one word answer questions, or like you can expect the 2 marks questions like like for example in the multiple choice questions, father of sociology, the main focus of sociology, which of the following statements are correct. Okay, for example, sociology is natural science, sociology is social science, sociology is physical science, sociology is concrete science. Like this kind of questions you may get. Okay, am I fast? Tell me. If you are not answering, how come I will know? Hmm? Tell me in the live chat box. Okay, your guys are not going to respond anything. It's okay, I will do my duty. I will wish to provide you the important questions for tomorrow's exam. So, listen, my dear students. Second unit is social structure. Okay, so this is all about the first unit. Next is social structure. Social structure is the thing which is like we have the important things in this particular unit is that the basic concepts of the society, community, association, institution. Okay, so the concept you have to understand, according to that you have to write about the differentiations also, and you may have to focus more on the characteristics, function, how it will be there, how it will develop, everything you have to know. The next one, individual and the society. Difference between the individual and the society, personal or disorganization. Disorganization is there here, and social group. Okay, so the group social group and meaning, characteristic, classification. Okay, based on that criteria we have make the groups. No, so a standard group will be there. Okay, so lower class, upper class, poor, rich. Okay, so based on their standards, based on their economy, based on their status, we have certain groups in the society, right? So that groups you may classified thoroughly you remember that, that is very important. Social process. Okay, so social process definition, farms, cooperation, competition, conflict, accommodation and assimilation, isolation. Definition they may ask, as well as they may ask about this also. The next one is socialization. So explain regarding the socialization, characteristics, process, agencies of the socialization is very important question. Next one is structure and characteristics of urban, rural and tribal community. Define community, explain about the structure and characteristics of the urban, rural and tribal community is one of the important question for tomorrow examination. Please study and go. Next one is major major health problems in the urban, rural and the tribal communities, importance of social structure in the nursing process. Okay, so that is very important in this particular second unit. Okay, so hope you got the questions. Okay, so based on that you just going to study, my dear students. Okay, so just a second. Yeah, you can see it over here that we have that agencies. Okay, review of the human growth and development, define socialization, examine the process and agencies of the socialization, critically examine the major health problems in the urban people. Okay, so now if it is this last time urban people they are asking, urban community they are asking, now there is a time to ask about the rural and the tribal. There may be a chance. Okay, who know that? So tomorrow only you will going to get. So that is how you have to cover the concept I'm telling. Okay, hope you guys are getting. Okay, so this is the thing. Then you short notes like write on the society, community, personal disorganization, primary and secondary group. Okay, so in the group out, in group and out group, cooperation, competition, accommodation, isolation, factors influencing the social change. Okay, this is very important, factors influencing the social change. Next one is that functional theory of social change, and we have the maximum theory of social change, cyclic theory of social change. Okay, these theories you have to focus. Health problems in the rural people, that I have already told. Okay, so these are, okay, don't forget this: conflict, assimilation, cultural lag, ethnocentrism, organic isolations. Okay, spatial isolation, crowd, mob, clan, sib. Okay, so this may, they may ask for the 2 marks questions. Okay, social mobility is one of the very much important topic. Okay, you have to know about that. Okay, so that is okay. So the next one is multiple choice questions, lot of questions are there. Okay, the third unit is culture. So in the culture, nature, characteristics and evolution of culture, diversity and uniformity of culture. Okay, so different cultures we have. India is a country, like we have the diversity in unity in diversity, right? So we all following the certain cultures, depends on their state, depends on their locality. So from every 100 meters or the 10 meters, the certain culture will be going to be changed, right? So my culture is different. Okay, so based on their caste, cultural beliefs. Okay, so this is how to focus more. Next thing, difference between the culture and civilization. This is also important. Culture and socialization and transcultural society. Define transcultural society is very important. Culture, modernization and its impact on health and disease is very important. Two things you have to focus: transcultural society and difference between the culture and civilization. There may be a chance to ask, or culture and socialization, there may be a chance to ask. Okay, hope you cover with this third unit. A few more questions I will tell you. Okay, don't worry. One second. Okay, yeah, few more questions we can see right now. This is very small unit, dear. Within half an hour you finish it off and glance it and keep it out. Okay, so sociology, don't worry. Okay, so focus more on the psychology also. Psychology also will be there, no? So sociology and psychology will be there. So next one is characteristics of civilization. Okay, so characteristics of civilization, function of a culture. Okay, so culture, discuss the cultural beliefs and practice encourage decline health, describe acculturation, culture consideration for nurses in nursing practices, unity and diversity of culture, culture and civilization, cultural lag, acculturation. Okay, again the topic is repeated. The factors of unity, factors of diversity, nature of culture, outcomes and outcomes of the acculturation. Okay, define acculturation, there may be a chance. Define cultural lag, important question. Okay, so next family and marriage. Fourth unit is family and marriage. So third is culture. Culture also I told. Okay, keep it with you, that pen and paper, write it down. Okay, so if because you also wants time to study, that is why a bit of fast I'm doing this class. So culture of over. Next one is family and marriage. Okay, so from this particular unit and the social stratification, there is maybe a chance to get the long essay questions. Okay, 10 marks questions. So family and marriage most of the time from this unit only. Okay, sorry. So most of the time from this unit only 10 marks questions. Okay. Now you listen that family and marriage. So here we have the characteristics. Okay, so family, what is family? Characteristic, basic need, types. Okay, nuclear family, joint family. The difference between the nuclear family and the joint family is also one of the important question. And the functions of the family, and we have the characteristics. Okay, the next one is marriage. Marriage, we have types of marriage. That is what forms of marriage. They can ask social custom relating to the marriage and the importance of the marriage. Why marriage is important? Okay, the next one is legislation on Indian marriage family. Okay, certain legislation, laws. Legislation means laws, legal orders. Okay, so that you have to focus. Okay, Hindu Marriage Act. Okay, so that act was there, no? So those acts you study thoroughly. Next, influence of marriage and family on health and health practices, how it will be influences on the health and health practices, this family and marriage. So these are the two phases of the society, family and marriage. Okay, so if you marry, you will build a family. Okay, so in the same roof the people will going to be have the shelter. Okay, so that is what. So the next one, in the family and the marriage, we have that important questions. I will tell you 1 second. Yeah. Define family. Assess the relative merits of nuclear and joint family. Okay, so the merits you have to list it off. Examine the influence of marriage and family on health and health practices. Examine the important marriage legislations, that marriage acts. Okay, the next one, examine endogamy and exogamy forms of marriage. Okay, so endogamy, exogamy, within, with, out of the relatives. The next one is forms of marriage: polygamy, polyandry, monogamy. Okay, so that one. Then functions of marriage, merits of joint family, demerits of joint family, customs of Hindu marriage, dowry system, functions of family, demerits of nuclear family. Okay, so whatever the topic I'm telling, no, focus more on that, frame a question. Okay, so that topic only particularly coming from this particular subject. Okay, then primary functions of the family, secondary functions of the family, marriage, legislation, and nuclear family, joint family, extended family, define extended family, endogamy, polygamy, polyandry, polygyny. Okay, annuloma and pratyloma marriage. These two, they can ask for the 2 marks questions. Okay, so multiple choice question, you know, you study this particular unit, definitely you can able to answer for the multiple choice questions. Okay, so these are the thing, characteristics of the family. Okay, next unit is that we have a social stratification. Okay, so the social stratification, introduction, characteristics and forms of social stratification, function of stratification. Strata means what? Okay, strata means what? The meaning of the stratification is the process which divides the society in a hierarchical order. Hierarchy, layer by layer. Okay, according to, based on that. Okay, based on the certain class characteristics, we are going to be do the division. Okay, so hierarchy. Okay, in the order. Okay, in a order where some strata are ranked higher than other. Okay, so I like higher to lower, we are going to be order wise the groups or the communities. So that is what stratification. Okay, the characteristics, for example, inequality in stratification. Stratification promotes the competition among the different persons. Every status has different prestige associated with it. Okay, so that is how the characteristic, that is how you have to study. Okay, so that is what fifth unit. So fifth unit important questions are like, you know, here we have the important questions, forms and functions and characteristics of the stratification. So they can ask for the 5 marks. The next one, evaluate influence of class, caste and race on health and health practices. Okay, so how it will be influences the caste, class and race on health and health practices. The next one is short questions like class, caste, stratification, define stratification, define racism, horizontal mobility, vertical mobility, social mobility, intergenerational and intragenerational mobility. Then list out functions of stratification, theories of caste, function types of social mobility, factors of social mobility in India, and the criteria of racial classification Indian human race. Okay, so this much which will be there. So this is the fifth unit, social stratification. Easy only this one. Next one, sixth unit, social organization and disorganization. So here social organization meaning elements, types you have to focus. Voluntary associations will be there, that you have to focus. Then the characteristics will be there in the voluntary association. Then social system definition, types and roles, status as structural elements of the social system. Interrelationship of institutions. So define institution, write about the interrelationship of the institution they may ask. Then social control, meaning aims and process of social control. Social norms, morals and values. Then social disorganization, definition, causes and controlling the planning. Okay, major social problems like poverty, housing, supplies, illiteracy, prostitution, dowry, child labor and child abuse, delinquency, crime. Okay, so this is very important. Juvenile delinquency, crime, substance abuse, HIV or AIDS and COVID-19, these are the important topics. And vulnerable group, elderly, handicapped, minority and other marginal groups, fundamental rights of individual, women and the children. Next one is role of nurse in reducing the social problems in enhance coping. Social welfare programs in India. What are the social welfare program will be there no in India, that you have to focus more. Okay, so these are the important topics, as well as they can frame a question on this particular unit also. Okay, so this is one of the biggest unit. Either we can expect the longest type of question from this unit also. Yeah. Okay, so this is the sixth unit. Okay, sixth unit, hope you guys are clear with that. Okay, so now you take things which is related to the important questions. Yeah, important questions are like define social control, examine the process and aims of social control. Define voluntary organization, analyze the scope and working of them. Then social disorganization, define social disorganization, evaluate the causes and control and planning of the social disorganization. Critically evaluate the social welfare programs of India. Evaluate the impact of HIV AIDS in India. Assess the role of nurse in reducing the problems and enhance coping. Okay, this much is there. Okay, so this much is there that you have to focus on it. Okay, so social organization, for example, define social organization, social norms, prostitution, defines prostitution, child labor, child abuse, social impact of COVID-19, voluntary groups. Okay, so this definition must and should you study about this, about the substance abuse, and as well as that we have the questions like juvenile delinquency, that is also very important. Illiteracy and alcoholism, definition you have to look it and go. Okay, so next one, social organization, social disorganization, dowry problems of age, role. Okay, role set, role conflict, minority problems, differently enabled people. Okay, this much you can expect it. Okay, this is the question from the sixth unit. Okay, now I will tell you the seventh unit. Okay, seventh unit. Okay, seventh unit is one of the very easy unit, that is clinical psychology. So the clinical psychology you can see it off. So how it will be, this clinical psychology seventh unit. One second. Lot of multiple choice questions are there. We can't tell those things. Why? Because no, there may be a highest chance from this unit only. And if I'm telling about the this one, for example, which of the following drugs not used commonly by the youth? Okay, so option A, opioids. Option B, cannabinoids. And option C, coca alkaloids. Option C, orphan drug. Okay, so 121 questions we have here in that. One second, sorry. Yeah, sorry for the inconvenience. Now we are going to see the clinical psychology 7th unit. Okay, so introduction to the clinical sociology strategies for developing services for the abused, use of clinical sociology in crisis intervention. This much will be there. Okay, so in this particular things you have to focus on the characteristics of the clinical psychology. Suppose now I will tell clinical psychology is also called as the extension of medical social control. Okay, so helping to revive the symbolic interaction is the sociology. Sorry, one second. Yeah, so that is all about the clinical sociology. Okay, so it is applied practice that focuses on the health intervention such as working with the medical practitioner, community health services, social policy and public health campaigns. Okay, so these are the things which will be there in the clinical sociology, sorry, psychology, not sociology, that we will call as a clinical sociology. Correct? No? So which we can able to applied in the where we are applied in the medical field or community health services. Okay, so medical practitioner time. Okay, so we are applying to provide services for the people in the community, that we will call as a clinical psychology. I hope you understood this one. This one characteristics you have to study: clinical psychology of health, of medicine, hospital sociology, don't forget, I'm telling wrong, dear, sorry. This always I will do like this only, this psychology sociology. Okay, so clinical sociology, now it's clinical sociology. The clinical sociology is that we are using in the medicine field, medicine practitioner, so applied in this field, so for providing services for the people. Okay, so in the healthcare sector. The next one is you have to focus more on the questions like define clinical sociology. Sorry, clinical sociology. Assess the role of clinical sociology in the crisis intervention. Okay, define crisis intervention also is one of the important question. Sociological strategies for the abused. Okay, so that you have to focus more. Okay, so child abuse, women abuse, domestic violences. Okay, so that you have to study more further of medical sociology and an area of specialist of clinical sociology. So these are the important. Clinical sociology is of like that kind of, they are asking the MCQs. So far we have discussed the 7 units. Okay, so now I will tell you whatever the questions will be comfort, like already I have told the important questions. So if you are not at watch, means go and watch it off, take a one pen and paper, list it out fastly. Okay, so take down the study, that glance it, and that within a half an hour you finish it off the watch you can finish it off the revision of the sociology. Okay, I'm not going to drag this particular subject because it is very easy subject and where you can do it. Okay, so don't worry about the tomorrow examination, only focusing on the writing skills. Okay, once you put a pen on the paper, the same flow, the same speed, the same kind of handwriting until your last question you have to maintain. By the time there is no distraction which we can able to see in the paper. Okay, so you are doing like this kind of things, like this some people are there. Okay, so they will write like this. Okay, what is this? What I can able to understand? What is sociology? Sociology is the study of. Okay, if I'm writing like this, what the evaluator can able to understood. Okay, so while writing the answer, little bit darken your handwriting. Okay, so that should be able to scan. Some people are writing very short. Okay, so no, you should not do like that. Okay, you have to write it off in a very good way. Okay, so try to write it off in such a form that introduction, why I'm writing like this, I will also write in a good way. Why I'm writing? Because you are not going to waste the time, my dear students. That is why introduction, definition, then we have to focus more on the things nature, if they are asking about the nature on scope, so elaborate your answer. Okay, so this is how you have to do it. Okay, so this is the major things. Okay, use of flow charts. Okay, use of flow charts. Okay, write it down, the role of nurse in the clinical sociology. What is the role of nurse in the clinical sociology? Okay, so write it off like this. Hope you got it. Okay, so let me finish off my class and hope you guys got all the important questions. Okay, so tomorrow we will see the paper, and all the best for your examination. Learn together with Nursing Guru. Subscribe to Nursing Guru. Thank you so much for watching. Thank you.